When transitioning a patient from a hospital to a long-term care facility, which of the following is most helpful in facilitating the patient's planning and emotional adjustment? A. Providing detailed medical records to the receiving facility. B. Allowing the patient to visit the long-term care facility prior to transfer. C. Notifying the patient and family well in advance of the transfer. D. Instructing the patient not to worry, as the transition will be seamless. Answer: C. Rationale. C. Notifying the patient and family well in advance of the transfer allows them time to adjust emotionally and to make any necessary plans, facilitating both planning and emotional adjustment. A. Providing detailed medical records ensures continuity of care, but may not directly address the patient's emotional adjustment or involve them in the planning process. And B. Allowing the patient to visit the long-term care facility prior to transfer can help familiarize them with the new environment, but it may not be as helpful in emotional adjustment as notifying the patient and family well in advance. D. Instructing the patient not to worry without involving them in the planning process may invalidate their emotions and hinder their emotional adjustment to the transition. 2. A client has been hospitalized for 6 weeks. All of the following interventions are beneficial, but which intervention is specifically focused on helping the patient cope with the emotional responses to prolonged hospitalization? A. Implementing relaxation techniques such as deep breathing exercises for the patient to practice daily. B. Encouraging the patient ambulating in the hallway for several minutes each day. C. Assisting the patient in creating a personalized space in the hospital room. D. Delivering personalized meal plans tailored to the patient's dietary needs and preferences. E. Ensuring the patient receives their prescribed medications as scheduled. Answer: C. Rationale. C. The patient's environment can help nourish wellness. Assisting the patient in creating a personalized space in the hospital room is specifically focused on helping the patient cope with the emotional responses to prolonged hospitalization by providing a sense of comfort, familiarity, and control in their environment. Rationale. A. This intervention is specifically aimed at helping the patient cope with emotional responses by promoting relaxation and reducing stress levels through deep breathing exercises, but may not directly address their emotional responses to prolonged hospitalization. B. Providing assistance with activities of daily living is important for the patient's comfort and well-being, but may not specifically target their emotional coping mechanisms. D. While important for the patient's physical well-being, personalized meal plans may not directly address their emotional responses to prolonged hospitalization. E. Ensuring the patient receives their prescribed medications as scheduled is necessary for managing the patient's medical condition, but may not address their emotional responses to prolonged hospitalization. Three, a new nurse is assigned to care for a patient who has recently been admitted to the hospital with a chronic illness. The patient appears anxious and hesitant during the initial interaction. Which action by the nurse preceptor would intervene due to damaging the establishment of a trusting relationship with the client? A. Focusing on completing the medical assessments quickly and deterring the patient's questions. B. Taking time to sit with the patient, making eye contact, and listening attentively to their concerns. C. Providing simple explanations about the treatment plan and asking for the patient's input. D. Offering reassurance and expressing empathy towards the patient's feelings of anxiety. Answer: A. Rationale. A. Ignoring the patient's questions and focusing solely on completing the medical assessments quickly can make the patient feel undervalued and ignored, damaging the trust and rapport needed for a therapeutic relationship. This action demonstrates a lack of empathy and respect, which are critical for building trust. Options B, C, and D are positive actions that help establish trust by showing the nurse's commitment to understanding and addressing the patient's concerns and emotional needs. 4. A new nurse is assigned to care for a patient who has recently been admitted to the hospital with a chronic illness. The patient appears anxious and hesitant during the initial interaction. Which action by the nurse would best demonstrate the establishment of a trusting relationship with the client? A. Quickly proceeding with the required medical assessments and interventions. B. Informing the patient about the treatment plan without asking for their input. C. Introducing themselves to the patient, sitting down at eye level, and actively listening to the patient's concerns. D. Asking the patient to sign consent forms before explaining the purpose of each form. Answer: C. Rationale. C. Introducing oneself, sitting down at eye level, and actively listening to the patient's concerns demonstrate respect, empathy, and a genuine interest in understanding the patient's needs. This approach helps establish trust and rapport, which are essential for effective communication and collaborative care. Options A, B, and D focus more on medical tasks and procedures rather than prioritizing the patient's emotional well-being and building a therapeutic relationship. 5. The patient's wife approaches the RN to inquire about her husband's condition. Earlier this morning, the patient stated that he did not want information shared with anyone in his family. What is the best response by the RN? A. Give the wife the minimum necessary information about her husband. B. Tell her that you are unable to share information about his health care. C. Enter the patient's room and ask him if it is okay. D. Tell his wife, but make her promise to keep the information private. Answer: B. Tell her that you are unable to share information about his health care. Rationale. Respecting the patient's privacy and confidentiality is a fundamental ethical and legal obligation for healthcare providers. The patient has explicitly stated that he does not want information shared with his family. Therefore, the RN must honor the patient's wishes and maintain confidentiality by not sharing any information with the patient's wife. Giving any information, even minimal, or asking the wife to keep it private would violate the patient's expressed preferences and potentially breach patient confidentiality. Asking the patient again may put undue pressure on him, especially if he feels obligated to change his mind in front of his family member. The most appropriate and ethical response is to clearly inform the wife that the nurse cannot share any information about her husband's health care due to his expressed wishes.